I mentioned it earlier, a lot of people hear the word hospice and see it as something scary. Our next guests take such a personal approach. Their patients are like family, and that eases the fear and stress so the good can come through. From Serene Care Hospice, Jacob Panowicz and Sarah Wheatherly. Good morning. It's nice to have you here.
Good morning.
The story about how Serene Care came to be, it's important to know that. What inspired you originally?
You know, the inspiration behind Serene Care really came from my own personal experience. A little over 7 years ago, my grandfather was diagnosed with Alzheimer's, and over the time, obviously, it got pretty bad, and, you know, before long, we needed hospice. And during his care, I remember distinctly contacting the provider and really wanting to know exactly what was going on with him. And I never really got a good explanation. I really never got anyone that was able to paint the picture for me as far as what was going on with my grandfather during this stage. And when he passed away with my father there, my stepmother, and myself. There was not a member of his hospice team there, and at that point in time, I decided that, you know, we had to do something. FizMed Home Healthcare, our sister company, we had to do something. We had to create a company that would go out and go above and beyond for our patients. You know, the best answer I can give you is why Serene Care was created was it was deeply needed.
And you saw that, and we'll talk about some of the things that make you different, hopefully, as this conference, because you talk about the Serene Care difference, and what you do with charts to me is one of the most remarkable things that families must appreciate exponentially, how open you are
absolutely do.
with some of that. But the idea of hospice is a unique type of care, so just at the core of what it is, how do you explain hospice?
Hospice is about making a choice. You know, when patients are diagnosed with a terminal illness, they don't have a choice in that. When you choose hospice, you are making a choice to live life to the fullest. You're making a choice to go ahead and to make sure that your family is taken care of, that you're taken care of, and that the quality of life is really, it's just, the quality of life is really intact. And for Serene Care, we do everything from as far as making sure that our patients, our families are involved in every step.
Yeah, and that's the difference, right? The charts, why do you open those up so that caregivers and families, patients can see front to back the charts that you're creating?
Well, one of the reasons, and it kind of comes back to why Serene Care was started, when my grandfather passed away, again, during his process on hospice, a lot of times I would ask the nurse, I would ask the caregivers, what's going on with my grandfather? Can you paint a picture? And no one can really do that. So one of the things that we do that's very unique here at Serene Care is that we open our charts 100% to all the family members. So if you are a power attorney, maybe you live in Baltimore and your father's on hospice, but you want to know what's going on. With the click of a mouse, you can get online, enter your username, your user password, and you can literally find out how your father did that day. You know, how are his respirations that day? You know, how was his overall mental status? Was he happy? You know, did he have a volunteer that day? We send out volunteers with our patients 2 to 3 times a month, sometimes more, sometimes less. But you can literally look online on this chart and you can see everything that's going on with them. If you're a physician and you want to know exactly what's going on with your patients, we give physicians access 100% to our online website. They can go on, they can see what the orders are, any change orders, any frequencies, any changes in the patient's medications. They have 100% access to everything.
And they can see it all. Sarah, as a social worker, what is your role with patients and their families?
You know, when working with patients and families, hospice can be scary, so we try not to make it scary, and part of that is education. So my role really is to educate our patients and families about what is hospice, how does hospice work in a home setting or an assisted living setting, and educating the patients and families. So talking to them about the signs and symptoms of the dying process, working with them on the financial aspect of this, making sure that they're hooked up with whatever resources they might need, planning for funerals. Sometimes people don't make preparations in advance, and so I help facilitate that, get them hooked up with a funeral home. And bereavement is such a huge part of it. We stay in touch with our families for up to 13 months following the death of their loved one. So offering that ongoing support, whether it be individual counseling, group counseling, whatever that family might need to help support them throughout their journey.
I don't know that you understand or that you're looking for that information until you're in that moment. right? And then you're so overwhelmed with everything, and it's such a difficult time. Is there ever a time where you say to families, now's a good time to start learning about this process, learning about what we have to offer, so that you're not as overwhelmed when it comes time for hospice?
You know, a lot of times it just doesn't happen that way. The best thing that families can do is that they can, if they feel that their loved one possibly is going to need hospice within the next 6 months to a year, they can go online to Serene Care, and they can educate themselves on what truly their family is going to be facing during this time, because when it happens, it's such a quick process. A lot of times we'll get a phone call and we'll go out within an hour or 2 hours to meet with the family just for a talk to, and that's really the time for our team to shine. We educate the families on what's going to be happening, what to look for, and exactly what they need. That's the big thing, is a lot of people don't know with hospice all the benefits that are there. When a patient and a family chooses hospice, they're electing to have the best care possible, but we take care of the medications, the DME, anything the family needs, we're there for them. And
because you were there, to me, is so compelling, and so you're treating others the way you would have wanted to have been treated years ago with your granddad.
Exactly.
Online at serenecareomaha.com, and if you have any questions at all, we encourage you to call the number there, and we'll have that information for you online too. Thank you both for being here. It's nice to meet you, Jacob and Sarah. A pleasure to have you on the show.
Thank you.
Well,